wonderful eye specialists, doctors who deal with children eye care and with squint. Now, these two women, Dr. Prachi Agashe, Dr. Nita Shanbhag, they have decades of experience of treating children with eye problems. So we are very lucky and privileged to have them with us today. Thankful. Do children, especially today, given that all our children today are and even or to one of the other gadgets. Children's eye problem questions. Dr. Nita, I'm going to ask you certain questions. Just who are one of my that is also probably is on the right. That yes, it is on. You know, this incidence is in more and more to actually reduce this incidence. Something to add on.
Thank you for the kind. Are in a 10 by 10 room. Even at home, them going and doing other activities has become the and probably encourage them to do that. But if distance not 10 feet, going to the minus numbers. Activity that going to it interspersed with maybe they will not remember, but if it is, you know, they're reading a book or a mobile game. She probably didn't have. And that's me. And when I communist phone and his telephone learn from you.
So, Dr. Prachi, and they're very this what parents can do contributed by Dr.
Shanbhag's epidemic form is absolutely but because of increasing awareness, the and the right which ensures screen time for the screen time is more. So yes, but apart from increase awareness and increase of children are okay, and I don't really see ensuring that that child is
Got it. So if I have to just, parent, I think what all of us need to practice more because the children with our laptop, they are developing more. Doctors, glass, they see properly, and not just for the that parents that your children that something may not see because sometimes don't even know suspected because of the behavior of the child close to the TV, suspected because going to the actually testing.
We start from the very beginning. I see when that happens. Many a times, the parents get probably we need respect. I say age to 6 months. Even if comprehensive screening, advocate, and even the consultant and no age limit below which we can try. So it will not be able to my child because child is not okay.
Child should undergo is good enough. Any I come to like a opinion about where they should
Always go to a from a refractive error. So one could, it could be because of some retinal problem. There could be something called as retinoblastoma, which happens in the preschool age group. So if you feel that the child is not normal and having serious, optometrist will only look at the rest of it. Optometrist is definitely an ophthalmologist. If he is ophthalmologist, yes, definitely. Again, there are to check because I think whether refractive error or only come only training, which check up with just preschool. Of course, after that you can follow up your regular miss label, not do with some.
dear parents, please you get child 3 and 5. Child is already uh, and then patients of your for your child eye specialist. You have now two here, Dr. Prachi, both of which are child eye specialists, at least with a child eye or these have done, and the should be done and with any eye doctor optician's place. A child, the way the checkup requires child eye care. These days, of course, of online fear of corona, there. But to a certain extent, parents that don't, they can't not think that parents do. Sure, there is some certain effect can be. Child's eye can back time. So, what are the things? Why don't you start and
tips are where it is. So try and ensure that the tablet or desktop or a laptop adjust the at 100% and match the surrounding. Make sure that there is no glare or any reflection of light on the child's eyes from outside also when the screen. Number 4 and most important is frequent breaks. So where classes there are supposed to be away from the screen. It should not be going from two classes actually to give between the gaps. So Dr. Nita madam can add on to it.
Yeah, madam, what?
Class with child screen those things are available, but they are so important to compensate that. Once you and the parents
Side, I thought there is in the company. We are talking about glass. The parent is really is Blu-ray glass. Nothing is really.
This is it's like that. About the health of advocate all these things. I said help you. The thing is that it's the parents
Right.
That should be out of their minds. They are not safe with the 20%, more than
Right.
that. So rather than classes. They have matter.
classes. And let them wearing their eyeglasses at the time as much as possible. For their entertainment, board games, or could be just play. That glasses, the blue glasses, or even the then side. Sure that your child is using less of to actually attend the question. They feel that looking at a particular do in that situation.
If there is a ratio, explain it in the eyes appear in form, which can wearing a these two forms, reducing the accommodation.
Would you like to add?
Amplify what basically it's a function of really helps clearly at all times. Whenever we look at an object, a nearer object or the muscle working more, actually driving. That is the reason may to see better. Actually trying to do, child is using that mechanism more especially with is we should not body itself squint and common definitely need doing it voluntarily. We want it's not very common.
Something at any to get your or the understand what is the problem and because now squint can be, which means you know I evaluated the time we are that has a squint and all of that. Squint to get necessary that they that, have for squint.
Um, Rise to a squint. Convergent squint is associated with squint and numbers. My is associated with the numbers checked. Check the fundus to rule out some having a macula because of which is unable, you will get a. Then you come to the muscle imbalance. Which child squint, and this is easily correctable with surgery. And sometimes it can concomitant squint. It could be meningitis are affected, and cranial nerves will give rise to paralysis of any of the intraocular or extraocular muscles, as a result of which the child will develop squint. So, doing a deeper analysis to know whether any of these problems exist is more important rather than all this is ruled out. The refractive error is checked, corrected, the accommodation power of the patient is corrected. Then, despite that, if the patient is having a problem, then surgery will definitely correct the residual part of the squint which is left behind in the eye.
Okay. Dr. Prachi, would you like to add on to what Madam has said?
Yeah. So, as Madam said, glasses is one important backbone of management of squint, because once we improve the vision by giving the correct power of glasses, once the vision improves, that's a signal for the brain also to use both the eyes together, and sometimes the squint can improve just with a simple pair of glasses. Another thing that needs to be addressed in squint is sometimes there can eye that gets lazy. So many times one eye tends to squint more as compared to the other, and that eye can get lazy. So patching is one more modality of therapy that is used in the management of squint patients. Patching is basically done to the eye which is used more often, so that the eye that is becoming lazy is exercised and used more, so the vision in that eye improves. Sometimes with patching, the squint can be corrected if it is a smaller angle squint. Apart from that, there are certain newer exercises that are available these days, wherein we, in certain types of squint, I would say, where the squint is intermittent and the child has some inherent ability to control the squint, there are certain binocular exercises that are available on computers and things like that, which can be made use of in treating certain squints. When all of these are, we have to decide case basis as to what for each patient. Sometimes these exercises, so we generally use some glasses, use some special glasses. So these are glasses wherein which is the normal patient. So third treatment, you
Okay. So if I have both have said, first of all, a child don't be not necessarily. First and foremost, contributing. So the first thing, your child, what is the cause? Number two, the corrected treatments. So for example, the treatment is somebody in your does not get a surgery, not these only one there is a residue after the non-surgical may be required for the best child, because there's lots of problems. It's going to another matter. If problem and before you answer that question, madam, we are not able to answer those questions for you. Please, you can put those questions in your comment section. We will get those questions from your live streaming, and we will make sure that we ask those questions from our experts. So please feel free to write down your questions. Yeah, madam.
The question was, child has a squint and that eye persistently inadvertent. They may not be which is not corrected. The child may which you normally have seen. Okay, there might be a relaxation. So the is in contracture might go in particular muscle, and there will be a now with aggressively than before. And again, this patient you cannot decision to the because there is a value to the surgeon. So in the I would advise parents that if you have a problem of basis, then logic attached to it. So you should advise and implement it rather than just sit.
Yeah. There are certain higher visual functions which I would like to, which get disrupted in squint. The number 3D perception, or the you view in a 3D a child with so visual functions. Loss is the field. Are the eye, which definitely. So that which really gets caught, which sometimes again dangerous, especially for driving. The vision, perception, and binocularity. Humans are really privileged to use both the eyes together. We see compared to
So a cosmetic problem only. Sometimes we feel, first is eye which has a stop seeing. That eye and it, which means this part field of vision in this case, right? And when I'm not seeing one eye, I don't like binocularity is stored upon us, and that need to the breaker or gauge the depth of a ditch or something like that. So that it the squint. So getting it done as the child side is a must. Surgery, we can actually surgical outcomes. Question: till what? Let's say a child develops for a reason. Ignored it, no problem. And age that
9 years. Before 7 years, between 9 years of age, you cosmetically be rest. Always better when you're time bar that you're not practically he may not get binocular any age, but it as early and to
Squinting is also so for squints that before 1 year for 7 months of age. In those children, for them probably so the onset of squint is important. So for a child age, come to a point in 6 years of age. Earlier, the hope to get infantile ease of exopopia half to 2 years.
in child side, very important that as soon as you notice some reason, then at whatever then the earlier the child, the squint is corrected either by non-surgical or by surgical methodologies, it's better for the child to get the functional benefits that the child loses. Definitely less than 7 years, a squint should get corrected because otherwise, post 7 years, the possibility that child will have binocularity goes down. After 9 years, it is almost sure that the child will not get binocularity even if squint is corrected after 9 years of age. So the best would be to actually go for an eye checkup as soon as you notice the squint so that it can be corrected at the earliest. And as I mentioned earlier, that it's not always that a child requires a surgery. Most of the time, it can be corrected. So we have so one of the but it is not as such. What with so Dr. Prachi or Madam
I doctor.
Ma'am, we know about that. Is from Nagpur. In case,
if they have not visited, I would recommend that they visit because their perception and actual is something else. Secondly, if they it is an intermittent thing, sometimes it means that the child is not able to obtain fusion. As a result, when the child is under stress or is in the fusion breaks, and that is what is going testing. Mm-hmm. So, whatever it is, the advice of pediatrician, then just wait and watch what is happening. the child because a different underlying reason to that intermittent screen.
Okay. Okay. So, Mr. Gaikwad, just to elaborate, minor squint rarely, in spite of the fact that you're noticing a squint, so is important. And even though it may not be related to screens, but there can be various reasons that I discussed earlier. It could be because the child has eye power. It could be because of some other problems. We will recommend, as has been mentioned by the experts, that please get your child's eye checked by a child eye specialist who are experts in squint as well, who will make sure that they ensure that there is nothing wrong with the child and that he does not need any kind of treatment for the correction of that. So that brings a question from Ms. Sumita Mendirata. Hours of screen time is permitted for an 8-year-old child already wearing glasses. Prachi, you want to take this question?
Yeah, sure. So there are recommendations that have been given actually by the American Academy of Pediatrics. So specifically for an 8-year-old child, so beyond 6 years, they haven't really given absolute specifications. But generally what I suggest is apart from classes, 1 to 1.5 hours of TV time is fine. And that's half an hour at one point in time, nothing more than that. So as I said earlier also, frequent breaks is something important. So if there are no strict guidelines as the overall picture about the child having to, attend online classes, plus their requirement and need of having some online entertainment, I think this is a fair amount of time that the child can, to strike a balance between the for the screen time. So in my opinion, apart from the school time, 1 to 1.5 hours or school time, let us consider school time of say 3 hours, and apart from that, 1 to 1.5 hour of television time.
So when you say television, can that be also a mobile? Like because some children want to play mobile games?
No tablets. Specifically because we don't want the near activity, near work to increase more. And also because of the size of the screen. Because again, as Madam had said earlier, we want the accommodation to relax. So when the child is watching television from a distance, it's a different mechanism that is working, and the internal eye muscles are not going to be that much taxed. That's why I specifically said television time and not mobile, tablet or laptop time.
So what I'm understanding here, Prachi, is that you're suggesting that if there is 3 to 4 hours of school timing, school online classes, beyond that, the child should not be looking at a mobile or a tablet at all. For some entertainment, they can watch maybe 1 to 1.5 hours of television from a distance. So parents, if you are actually, and what about the homework? Because these children also have to do homework on with their gadgets, and how do we recommend that to these parents?
So what I would suggest is we should generally take printouts of the sheets that are there, and the child should do some work, writing or whatever the way it should be done, and then put it and then upload it. So the screen time for these things, wherever it can be minimized, should be minimized. The time that I have said right now is again because of the unprecedented circumstances that we are in. Otherwise, if I have to just truly recommend without these circumstances being there, I would still say it should be just 1.5 to 2 hours of screen time. That's about it. If the child was otherwise regularly attending school, then it would not have been anything more than 1 to 2 hours of screen time in a day.
Okay. So if assuming there is no corona and there are no online screen time, given that our 3 to 4 hours of requiring online classes. So in that case, the child should not be looking at any other near gadget like a mobile or a laptop or a tablet longer than that. Even for school homework, they should be printing it out and doing it like how they normally do their homework and then uploading that homework rather than using a gadget to do that homework. But besides all this, for their entertainment, 1 to 1.5 hours time can be done. Madam, are there any exercises? So Dr. Mendirata, Ms. Mendirata is asking, are there exercises which can reduce the effect of online classes and online time on child's eye?
Uh, I think it is better to avoid rather than do something and then exercise for it. You're using your eyes even to exercise. There is strain on the eyes even when you're exercising.
Right.
So it's not going to relax whatever you're doing. So better do it in the first place.
Okay. So parents
Can I just add on to it? Yeah.
Yeah, please go ahead.
So basically, if there is a problem in the eyes or in the internal musculature, then there are exercises that can be given to treat those problems. Okay. Regular exercises that are otherwise advocated online as palming or movement of the eyes, at an individual level, if a person feels better doing that, you please go ahead and do that. But it has no scientific basis to really doing those exercises. Related to the screen, there is a set of problems called as, binocular vision problems, which are not related to strabismus. So those are certain type of tests that we do to, just find out if there are any problems in the internal focusing systems of the eye. And there are specific exercises to treat those problems if we find any. As we had said with the accommodation, there are certain problems wherein the accommodation doesn't work very well, which we are finding a lot, especially in the IT group of people who have long hours of work on the laptop. There can be certain problems in, keeping the eyes focused in the same place for a certain amount of time. So there are specific exercises for treating these problems. So if you feel that your child is having an issue or is complaining of headache after school or after watching screen or while studying, then those are the children in whom we really need to do these battery of tests to really see whether, any of these problems are there. And then we can suggest exercises for that. But otherwise, just taking treatment breaks and maintaining proper screen hygiene habits should be good enough to take care of the screen associated problems.
Okay, so if I have to sum it up, both the experts are of the opinion that really no exercises can take away the effect that these screens have on your child's eye. If there are specific problems which are not necessarily only related to screen but get enhanced because of the screen time, which could be accommodative issues or could be some other muscle imbalances. Now, some of these can get enhanced because the child is using excessive screen. Then, yes, certain specific exercises or other kinds of treatments can be recommended for that. But just because you feel that your child is using excessive screen, and can that effect be reduced by other kind of exercises? The answer to that is no. The only treatment for that is to actually reduce the screen time. There is no other treatment really to nullify the effect of the screen which is being imposed on your child's eye today. So I have another question from the audience. What are the chances of recurrence of squint after the surgery? So Nita madam, would you like to comment on that?
Yeah, whenever I operate on a squint patient, I always tell them don't expect 100% result. One, because it's a part of the eye which you cannot predict will behave in a particular fashion. I can have a predictive value of 90% and say that, okay, 90% of your squint will get corrected. And believe me, 9 out of 10 times we are being able to give 100% result. But there is something called as inherent tone of the muscle, which can undercorrect or overcorrect. We have different surgeries like, where you can titrate the surgical result post-surgery on table also. But to tell a patient pre-operatively that this is going to be 100% like a cataract surgery, I think we shouldn't do it in squint because it is not having that kind of predictive value. Though 9 out of 10 times we will be able to give a 100% result, there is 1% per patient who may not get a 100% result and should be prepared to undergo a second surgery, which will then deliver the desired result. So it should not be that the patient feels that, oh, this surgery has not given me 100% result, meaning the second surgery is going to be done because the first surgery was unsuccessful. It's not like that. The first surgery is not predictive because of the inherent tone of the muscles, as a result of which the second surgery would probably be done to titrate the residual problem. So it's not an unhappy outcome that you see. It is just that you need a second surgery to titrate the first surgery. So the patient should always be willing for a second surgery to get an optimal result.
Okay. So, but what about, let's say the first surgery was perfect and now there is a recurrence. So what are the possibilities of recurrence? Dr. Prachi, would you like to comment on that besides what madam has already said?
Yeah, I to just get a question right, what are the possibilities of recurrence after squint surgery?
That's right. Yeah, that's the question.
Yeah, so I entirely agree with whatever Madam has said, but we need to also understand as to why the recurrence has occurred. So what we need to understand that squint, though may seem just a problem with the eye, we should not forget that it is related to the brain also. So basically the center to keep both the eyes straight lies in the brain. What we are doing with the squint surgery is basically helping the brain to accept those images with the eyes and to make it single and to keep it that way. So what response we get from the brain is not entirely in our control. So a bit of the success of the squint surgery lies in how the brain also takes it. That's the reason that we try and advocate earlier surgeries, because we hope that the brain is in a developing stage that time and can accept these results better. Number two, sometimes the squint evolves over a period of time. So what I mean by that, we tend to see certain muscle overactions and underactions sometimes later in the squint, which were not there earlier and can contribute to the squint coming back. So we need to understand that it is not a constant thing. Squint is also a kind of a dynamic thing which can keep evolving over a period of time. So especially in the younger age group, when we do the surgery, some overactions, underactions of the muscles are seen later on. But the good part about a recurrence is that I would say it is absolutely treatable. It's not like if a squint surgery has been done once, then it is done for all. We cannot do anything about it. It is never like that. So, and again, it is not always for the recurrence that a second surgery is always required. Again, we can try non-surgical modalities for some exercises or prism classes depending on the magnitude of the squint. So, if I had to put it in percentage, maybe the recurrence rate I would say would be say 1 to 2% in post surgery. But otherwise, most of the patients would generally tend to do well.
Okay. So I think an add-on to this question by the same patient, Mr. Jayantilal Shah, is that I had one squint patient where one surgeon says operate on one side, whereas the other surgeon says operate on another side. What is the reason? I think this is a common dilemma that you people have to face. So, Madam, would you like to comment on that?
See, you can operate on either of the eyes to correct the squint. That is what we always explain to the patient. So even if the squint appears in the right eye, you can operate on the left eye and correct it. And if it is in the right eye, you can always operate on the right eye and correct it. So there is nothing like there is a squint in one eye and the other eye has been operated, so it's not going to happen. There is a muscle balance between the two eyes. So any eye can be operated and anything can be corrected. So get it out of your mind that, this is the squinting eye, so that eye only has to be operated. It's not like that.
Got it. So, Mr. Shah, if one surgeon said one eye and the other surgeon said other eye, then probably both are right. As Dr. Nita mentioned, that sometimes even when squint is in a particular eye, sometimes we have to operate on that eye or the other eye. And given that the muscles of the two eyes work in sync with each other, operating on either eye can actually correct the squint. Very often, surgeons have to correct squint in one eye. They have to actually operate on both the eyes, because sometimes depending on the angle of the squint or type of the squint, just doing surgery on one eye may not be enough. So please do not be worried that if one surgeon said one eye and the other surgeon said other eye, both the things could have been correct. Okay, so that moving on to another question, which is a little bit of a more common question, is related to chalazion. According to one patient, he's saying that there was a chalazion it's from Mr. Nagnath, that 8 to 9 months back, there was a chalazion in the right upper eye, and even after proper medication, some drops and creams, for 6 to 7 months, it has not gone. A few months ago, it turned into an internal hordeolum, and the bottom of the same eye and the left eye also developed chalazion, swelling, chalazion pus. The ophthalmologist suggested a surgery as the infection could spread. Does the screen time affect this? So a long question, sorry for that, but I wanted to make sure that I put forward the question as has been asked by the patient. So Dr. Prachi, you want to comment on this?
Yeah. So chalazion, what we need to understand is all of us on our lids have something called as the lipid glands or oil glands basically. So for some unknown reason, the reasons may not be entirely known, but it can be related to some diet or stress. Sometimes those glands tend to get blocked, and the secretions tend to get thicker, due to which the glands get blocked. So the secretions inside these oil glands tend to pent up And those are the reasons why these chalazions are formed. Sometimes these can get secondarily infected, because of which what you said was a hordeolum, which then needs to be treated by oral antibiotics and local antibiotics. Uh, so what the underlying reason for a chalazion is many times an uncorrected refractive error rather than just the screen time. So that is something that really needs to get evaluated and corrected. And apart from that, the oil glands really need to be massaged, and they need to be given some warm compresses over a really long time for these secretions to liquefy and normalize, and for the glands to then get normalized. If the chalazion does not respond to just hot fermentation and local antibiotics, then we need to really just open up that gland and drain those secretions, which is through a very minor procedure, especially for the gland that is not responding to the warm compresses.
Okay. So I think, just to sum it up for you, Mr. Nagnath, as Dr. Prachi has mentioned, the chalazion is just basically accumulation and collection of secretions which pents up inside these oil glands, and they can get secondarily infected, which leads to swelling, pain, and sometimes pus and all of that also. Most of the time, if that happens, hot fermentation and some local antibiotics, and very rarely oral antibiotics may be prescribed for that. Now, naturally, after this, if the swelling persists and it is not getting corrected by your hot fermentation and by local massages, then doing a minor surgery can actually help. As far as the causes are concerned, a lot of times the causes are not known, but sometimes uncorrected refractive errors, because of which somebody is straining their eyes, use of excessive screen and then rubbing your eyes profusely with your fingers, basically, because of the strain or because of dry eye or because of other reasons, that can also contribute. And very rarely there are other lid disorders. For example, people who have dandruff-like coverings on the lids, we call it blepharitis. And in some people, they have an inherent predisposition, because these glands, for example, some people get a lot of pimples on their skin. Just like that, some people are just inherently predisposed to develop these swellings called chalazions. Either case, if they are not resolving by medical treatment, then a minor surgery can help. And also getting yourself evaluated that if there are some underlying conditions, if there can be other kinds of treatment which can keep those underlying conditions under check, can also reduce the propensity of developing these swellings. So that brings me to another question. Are the computer glares advisable for 8-year-old for online classes? We have already answered it, but why don't we just answer it for the benefit of the patient? This question is asked by Runjhun Jain. So Dr. Prachi, you want to quickly just elaborate what Madam had already
All right.
Yeah.
So a quick recap of the points for online classes and online use is: bigger the screen, better it is. Number two, the illumination of the screen should not be at 100%. It should be just optimum. Make sure that the illumination on the screen matches the surrounding illumination. Number four, make sure that frequent breaks are taken. So especially for the online school classes, make sure that the intervals between the classes are screen-free intervals. The child should not move from one gadget to the other. And there is limited or almost no role of blue blocker glasses. So blue blocker glasses is not the answer to just protecting the child from the screen. It does not mean that once the child is wearing those glasses, the child can happily use the screen for 10-12 hours a day. So these are the points that should be taken care of in these times where the screen time has increased a lot for children.
Okay. So just to answer Runjhun specifically to your question, computer glare glasses most of the time do not have much of a role to play as far as the effect of the screen on the eyes are concerned. It is better to take care of your child's eye through other recommendations which have been given by both the doctors, namely frequent breaks, larger screens, adjusting the illumination, and making sure your child is wearing their glasses if they have any, rather than just wearing computer anti-glare glasses, because most of good gadgets and most of the recent gadgets actually have an inbuilt anti-glare protection inside. So an additional anti-glare protection is not going to really safeguard the child's eye. And Blu-ray glasses definitely are of no use at all from protecting your child's eye from the effect of the screen. So that brings me to another question. Should the screen time be altered as a temporary treatment? Now, I don't understand this question. If either of you have understood this question, then please go ahead and answer this. This is from Mr. Nagnath.
Can you just repeat it?
Should the screen time be altered as a temporary treatment? This is the same person who asked about the chalazion. So maybe he's asking in relation to the chalazion itself. Should the screen time be altered as a temporary treatment?
No,
Maybe
I think we
related to
have
chalazion.
answered well about the screen time. So I think those things need to be adhered to.
Okay, perfect. So, till what age can squint be corrected through exercises and not surgery, especially if it is a minor squint? This is a question from Namrata Masani.
So again, I mean, because this is the second question that has come up with respect to a minor squint, let me just put it that, it should not be decided as to whether a squint is minor or major just by observation. Okay, I mean, though you may not be seeing the squint to be very evident, it can still sometimes, the vision in the squinting eye sometimes can be really low. It really, the vision loss does not really depend on the visibility of how severe the squint is. A minor squint can also sometimes, land up in the child literally almost having very less vision in that eye. Again, as we had mentioned earlier, we got to get to the core of the reason as to why the squint is there, why that whatever is it a minor or major squint, why it is there. So whether glasses or exercises are required can be concluded only after an evaluation. Again, there is no age for it. We treat children, adults alike with exercises or with glasses if the squint is intermittent and there is some capacity in the person at whatever age to use both the eyes together. Now that is the time when these exercises can be tried. However, if the squint has reached a stage wherein both the eyes are not really being used together, then these exercises would be of no use, and then we would have to sometimes resort to patching therapies or occlusion therapies to improve the vision first, and then see how it moves further, whether it can be tackled with exercises or surgery. So let me just emphasize again that don't consider minor squint as a minor issue just because you don't see the squint or you don't perceive the angle of squint to be a very large angle.
Got it. So, Namrata, yeah, madam.
I think you should let the doctor be a part of the team rather than just do things on their own.
I agree with you, madam. So I think, Namrata, to answer your question, now you may think your child has a minor squint. A squint is a squint irrespective of whether it's a minor squint or it's a major squint. Irrespective of the angle of squint, whether it can be treated with exercises or it can be treated with patching or whether it requires the surgery is dependent on the reason behind that squint and what are the other forces at play, which can be checked only by a good squint specialist. So if your child has a minor squint, please get your child checked by a good squint specialist. We have two wonderful experts here, one sitting at Advanced Eye Hospital in Sanpada, one sitting at Ayush Eye Hospital in Chembur. Depending on where you are located, please go and take your child to these experts. Let them see what is the reason behind that minor squint in your child's eye and if exercises could be of use for your child's eye or something else may be needed. So please do not prejudge that just because it's a small angle squint that exercises alone will help. They may not be the only thing required. Okay, so with that, I'm going to hand over the baton to Dr. Sneha, who is here with us. She is again a very, very young, dynamic doctor. She is a glaucoma specialist, but thanks Sneha for taking the baton from me and moderating this session. So we will be continuing with this journey. Dr. Sneha will be moderating. Dr. Prachi, Dr. Nita, once again, thank you very much for being here and for sharing, all your expertise and educating our audience here. Thank you very much. Sneha, over
Thank
to
you, Vandana.
Thank you.
Thank you, ma'am. So good afternoon to each one of you present. So Prachi ma'am and Nita ma'am, we do see in our clinic, especially in the waiting area, you do see kids that have this layer of kajal and surma that is applied. So I wanted to ask, and how do we educate these parents? Because in certain customs and traditions, it's considered good luck. So please tell our parents about this.
You want me to tell Sneha? I would say don't entertain them when they come with kajal and surma. If you refuse to see them, they'll automatically not put it.
Yes.
Now, for the audience, I would like to say that our lid glands, okay, their pores open out onto the lid margin. Now, if you're going to apply kajal or surma, these glands are going to get closed, as a result of which there will be accumulation of sebum into these glands, which could give rise to infection or inflammation in the form of a stye or a chalazion. So that is the main reason why all these things happen. So they should not be used. So lid hygiene would be the first primary thing in treating lid problems, and surma and kajal do not form a part of the lid hygiene. So they are out and out. So whether it is custom, tradition, it's not to be followed.
Yes, yes, rightly said, ma'am. Prachi, ma'am, would you like to?
Yeah, I agree with ma'am.
anything?
So just to, keep up with their sentiments, I just tell them you can apply a black tika anywhere on the cheek, head, wherever. Also, sometimes, the lead content of the kajal is something which we really don't know how good or bad it is, especially for a child. Sometimes it can really, alter the hemoglobin levels if it gets absorbed through the mucosa and things like that. So that is another health hazard that I think we should just educate them about. And if at all just they want कि किसी की नजर ना लगे types, you just apply a black spot anywhere on the head, cheek, wherever they feel appropriate, other than the eye.
Yes, rightly said, both the doctors here. So, to all the parents who are hearing us, it may be good luck according to you all, but it will not be beneficial to your child's eyes. So please do not apply kajal, surma, anything, even if it's made at home. We have some parents who say that we've made it at home, but still our advice would be please don't apply kajal and surma. Another thing that we do get patients and parents who say that, we just made a glasses prescription, say 15 days or 1 month before, and it keeps on changing. There's a minor difference between 2 doctors or 3 doctors that they've visited. So which prescription usually should they follow, Dr. Prachi?
Okay. So I would say, see, what we need to account for is number one, you trust one doctor and follow that doctor is one thing that they have to trust one person. Secondly, what we need to understand is we need to see how the power has been checked. So generally, if it has been done by a pediatric ophthalmologist, it would generally be done under proper cycloplegia. So cycloplegia is basically a process wherein we use some special drops in the children's eyes to relax the internal muscles so that we can estimate the exact power in the eyes. A small power difference of around 0.25 or so is likely to be there between 2 people, 2 machines. It's an inter-observer variability. So that it makes no sense to really, change these glasses for that small change in power that may be evident just because 2 or 3 people have checked differently. Also, many a times this doubt arises, especially for cylindrical corrections, because once it is being prescribed in a what we call as a plus format, another time it is being prescribed in a minus format. However, the power means the same. So, I think that should be made clear to them that this is more or less the same power. You just have to continue. So we just have to look at how the process has been done. And again, which doctor to follow is not something we should advocate. That's for the patient to choose as to which doctor they are comfortable with and they would want to continue treatment with. So you have to trust one person and go ahead with the prescription of that person. But for us to, if I have to really recheck or we get patients for second opinion, I just would recheck the power again under cycloplegia and see if it is more or less the same. I would really not advise a child to change that pair of glasses.
Prachi, can I interrupt over here? Most
Yes,
of the time, the problem is that they go to an optician who does the refraction on an autorefractometer. And then they come to a doctor. So the doctor is doing a subjective refraction. The optician has done an objective refraction. So there is a difference in number. Always remember when somebody puts glasses in front of your eyes and you can see through them, that is the correct number because you have read through them. So if you have read through those glasses and that number has been prescribed to you, that is almost always the correct number. So don't go by the fact that, the optician gave me a different number, this doctor gave me another number, the third one gave me something. What you read through, and if you have read through till the last line, that is the correct number which has been prescribed to you. That should be a common goal that, okay, I could read me, this is my correct number. So follow that basically.
Yes. So to sum it up, I would just say that do not consider your optician as a doctor and consider the doctor as a second opinion. It has to be your ophthalmologist, especially a pediatric ophthalmologist to whom you go for your eye checkup. So Now, is it possible to get rid of glasses before the age of 18? Shanbhag ma'am.
Here I would like to educate our audience that our eye grows. Okay, it grows till our height stabilizes. Your height will increase. Similarly, the length of your eyeball will increase. So till your height stabilizes, your refractive error doesn't stabilize. Now, suppose I have a child who comes to me at the age of 16 or 17 and says that I want to become a pilot. So I want my number corrected because I have to go and appear for the exam at the age of 17. Now, if I correct his number, his growth is not complete. Why we take that number of 18? Because it is FDA approved. They always say that till 18, the child is going to grow, and probably there is growth even after that. But there is a standardization which they have put, and that is the age of 18. Now, suppose I correct a child at 16, and after that he continues to grow, and the number continues to increase. So, what have I achieved? I wanted to give him freedom from glasses, and after I have corrected him, he has acquired another number. So that's not the right thing to do. You have to correct the whole number at one shot. So I would always say that let the refractive error stabilize. And according to the FDA, 18 years of age is the number which they have put as the demarcation for us not to correct before that any refractive surgery. So it is not legal for us to do something like that. However, sometimes there is a child who has, say, minus 12 number in only one eye. The other eye is absolutely normal. And we all know that we cannot correct refractive errors more than minus 8 or minus 9. And with minus 12 or minus 14, this child is going to develop a lazy eye because the number has not been corrected. So under those circumstances, with due counseling of the parent, I think you can go ahead and do the surgery with an audiovisual consent, telling them that probably this number might increase and this surgery has been done only to prevent a lazy eye and an amblyopia and to reduce the number so that the child can now comfortably wear glasses for the residual number and get back the vision which he has lost because of unilateral ametropy.
Yes. Dr. Prachi, would you like to add anything, please?
No, I entirely agree with whatever Madam has said. I have nothing more.
Yes. So, if you're less than 18 years of age, we would try and not perform any refractive surgery on you. But there are certain exceptions, like Shanbhag Madam has just said, that if your eye has a minus number which is high, or even for that matter, plus number which is very high, we would consider it, but very special cases, not for everyone. So another question coming up to, yes, we have kids who are wearing spectacles. Now, when they are in their teenage, they do want to wear contact lenses. So what would be the ideal age that you all would ask the children, switch them from spectacles to contact lenses if they would like to wear one? Shanbhag ma'am?
If you really ask me, I would give a contact lens to any child who can handle the lens. Yep. I have done even at the age of 4 because the child had minus 18 as a refractive error in one of the eyes. And that time we didn't have all these refractive corneal surgeries. So minus 18 with glasses cannot be corrected because the other eye was something like minus 2. So the difference between the two eyes was minus 16. So I didn't have a choice. We sat and educated that child. 4-year-old child learned how to put in the lens only because the child could see after wearing the lens. So it is definitely a motivation for the child because once you teach them how to insert the lens, they can see with that lens. So they will always wear it. Of course, the hygiene part and all, it's too small for the child to understand. So the parent has to be in the loop to teach them how to handle the lens, how to clean the lens, how to store the lens. All that becomes a part, and there should be a close follow-up because contact lenses have the hazard of getting infection. But if it is mandatory to wear one, you should educate the child and give at whatever age they can handle the lens. So that age should not be a bar. You give it as long as they can handle it.
Yes, true. Dr. Prachi, would you like to add anything to this?
So to come specifically to your question about teenagers not wanting to wear glasses and to look smarter without glasses, I would say around 11, 12 years of age, considering our climate and things like that. Again, it's not like a specified age, but generally beyond 11, 12 years of age, generally if the child is not wanting to wear glasses and look better, I suggest them to wear contact lenses. But for functional reasons, like the example that Madam gave, there is a set of children whom we operate cataracts on, for whom we give contact lenses right from 2 months of age also. So there are exceptional circumstances where age is no bar to giving a contact lens. But if it is just for teenagers who don't want to use glasses and wear contact lenses, maybe from around 11, 12 years of age.
Okay, and Dr. Prachi, any precautions that the kids have to follow with contact lenses? Because we do see quite a few of infections even in adults when they use these contact lenses. So, what would you advise?
So all the precautions. So the precautions do not change with respect to age, I think. So whatever age we give it, the precautions have to be maintained. In fact, I would say probably the infections are slightly lesser in this age group because they are supervised by the parents. They make sure that, they don't try to abuse the rules. If we say it's 6 to 8 hours, it is that much. The parents most of the times ensure that, the over usage is not there, the hygiene is maintained. However, with adults, I think these, rules tend to get over abused a little bit. They would still continue using the lenses beyond the expiry and things like that. So the regular hygiene that requires to be done with cleaning the contact lens, regularly cleaning the case, making sure that the hands are washed and cleaned before putting in the lens should be followed regularly. Yeah.
Yes,
I would like to add something over here. Maximum number of infections I have seen it because they have forgotten to carry the lens case and then clean the lenses in tap water. So that is a no. You never do it. In case you ever have a problem where you don't have your contact lens solution, please buy a tear substitute from a nearby shop and use it as a contact lens solution rather than tap water.
Yes, ma'am. Now coming to what you just mentioned, tear substitutes. Is it safe? I mean, we do have parents whom we say that your kids do need these tear substitutes. We call them lubricants, especially because they're sitting online or they have some allergy. We do keep them on these lubricating drops. So are these, can you just tell our parents, like, are these safe and how often can we use them?
In children?
Yes, in children.
I feel that most of it is a hype unless it's really indicated. Very rarely do children have dry eyes.
Okay.
So rather than putting drops and doing all these things, it is better to reduce the screen time.
Yes.
So treatment should be a temporary thing to tide over a temporary problem. It should not be a permanent solution at a very young age.
Okay.
There are diseases like, where sometimes the children have a dry eye, but that I would say 1 in a million. So it cannot be the norm and they should not be taken as an example over here. But as far as children should not be into a habit of using things because they really don't need it. And you should treat the cause rather than, do all these kinds of things. But Prachi can have a different outlook. Prachi, you can comment on this.
No, I agree with you. But on the other hand, it's not harmful to use lubricating eye drops. Sometimes parents just feel more comfortable, about doing something by putting drops for them. So if they are comfortable using it, fine. I mean, you can tell them, okay, only these sets of drops are okay. It's better that you tell them 2 or 3 names rather than they going to the chemist shop and buying something which is, not or can cause more harm. It is better to tell them these are lubricants. If on a particular day your child complains that he's not feeling okay in the eye, feeling some foreign body sensation, you go ahead and use it. And you tell them that once you open it, you can use it for a month and the regular instructions that we give. But yes, otherwise, dry eyes is not very common in children. Yeah. That's absolutely true.
Yeah, yes. But I have always found that they would not waste time in educating and disciplining the child not to do the screen time, but substitute with a drop thinking that their job is done. So that should not be the norm.
Yeah.
Yes, because
that is a very strong message which I'm trying to give, that you should treat the cause.
Yes, that's what, because, we have parents who do come and they are like, we are using these lubricating drops and now it's better. So they keep on using them, but the child's screen time is still the same. In fact, it may have increased also. So yes, ma'am, that's very important that we don't have to look at a temporary fix and we need to do lifestyle modifications for our kids also. So, Prachi, ma'am, would you like to say something about what are the genetic diseases that we see in the eyes, and can it be picked up at early age?
Can it be picked up by?
At an early age.
Yeah. So genetic diseases can, present from birth to even sometimes later in childhood. It can be present in any layer of the eye. So it can be a corneal problem. It could be cataracts. It could be a retinal problem. So what the important history over here is, I think, a family history. Or it could be the tumors inside the eye. So the family history here forms a very important basis to really picking up these problems. Already, if you are treating a patient who has a family history of any eye problems, be it a retinal problem, be it glaucoma, be it a tumor, be it a corneal problem, then yes, we should be advising those patients to get their kids checked at an earlier age. So we do get these kids sometimes at an earlier age, but many a times at birth or so, many a times their eyes tend to be normal. But what we need to do for them is to really follow them up closely, looking at what is the family history. Like suppose there is a history of congenital cataract, maybe you would want to follow up that child at 2 to 3 months, 3 monthly follow-up, rather than just calling the child after a year or so, if there is a history of congenital cataract or something like that. So all these problems can be picked up through regular screening. Only thing we have to be more watchful for it and base our suspicions on the family history that we get.
Dr. Shanbhag, would you please like to add anything?
No, I think she has covered adequately. You can go to the next question.
We do come across parents who do say that my child's one eye is bigger in size as compared to the other eye. So do they need to visit an ophthalmologist, or some parents even say it's just, it's God's grace, it's beauty. These are the words that I have come across. So, Shanbhag ma'am, would you like to say something?
The very fact that it has come as a question, that means there is something which is not right. If it was right, there would not have been a question. So whenever there is a difference between the two eyes, I think at least the eye doctor should be visited once to find out whether there is an inherent problem. Sometimes there can be a thyroid eye disease which can give rise to a difference. There could be a lid which droops in one eye, giving rise to a difference in the palpebral aperture. So all these things are not seen by an untrained eye like that of a parent or a layman. They are only seen by a trained eye like that of an ophthalmologist, and especially a pediatric ophthalmologist. So please visit at least once to the doctor. We take years to train to see all these things. So at least, make sure that you take advantage of our knowledge and avert a problem which can later on be a major problem. One visit is mandatory if there is some difference between the two eyes.
Yes. Dr. Prachi, anything more you would like to add?
Yeah, I think they should not just be sitting over this. It can just be, something very underlying serious issue. If there is a genuine difference in the size of the eyes, couple of problems already madam has stated. It could just be glaucoma, uncontrolled glaucoma. Worse, it could be some mass behind the eye that is pushing the eye forwards. So they should be making an appointment with the eye doctor as soon as possible, I would say.
Yes, rightly said that in equal eyes, the parents please go to a pediatric ophthalmologist, because that's not normal. It has to be checked, and the cause has to be evaluated. So we have a question by Ruth Miranda that is there any treatment option besides steroid drops for allergic conjunctivitis, Dr. Prachi, especially if it's recurrent?
So absolutely yes. Okay. So we need to understand that steroid eye drops is something that we generally reserve for problems or episodes of when the allergy tends to be severe. So let us understand this allergic conjunctivitis can sometimes be a chronic problem which continues for months and years together. So generally the way it is managed is, yes, sometimes steroid drops, but there are other group of anti-allergic medications like antihistamines, like mast cell stabilizers. So there are various 2-3 groups of drugs which are used along with the steroid eye drops to bring the problem under control. Once a severe episode is controlled with the steroid eye drops, generally we actually try using or not using the steroid eye drops and just controlling the patient on these other group of drops. Looking at the severity and the chronicity, sometimes we use special immunosuppressing eye drops or medications like cyclosporin eye drops or tacrolimus. So these are special group of medications that are definitely used for allergic conjunctivitis and which are probably safer to be continued for a longer time if required as compared to steroid eye drops. So we need to understand that steroid eye drops has a definite side effect of sometimes causing cataracts and glaucoma. So they should never be taken over the counter and be instilled without consulting an ophthalmologist.
Yes. Dr. Shanbhag, would you like to add anything?
I think the audience to let the treating doctor decide, because there is a particular pattern in which these drops are used. You start with the steroids, then you go to lower grade of steroids, then you go to immunomodulators, you add your substitutes. So it's a process basically. You cannot substitute directly. So let the doctor decide what comes after what, and let him do the maintenance therapy for the child, rather than deciding that this drop is good or that drop is good, because they have to follow a pattern. And as Prachi said, I think whatever she said makes sense. Everything should be followed, but in a pattern, and that pattern has to be decided by the doctor.
Yes, very true. It's that with steroids, yes, the dose would be advised by the doctor, and then we would switch on to lower dose steroids, like you said, madam, and the other immunosuppressants that are present. But what we've seen is with steroids, it's somewhat a quick fix what the parents see. So sometimes they do not come to the doctor and they do think that this is an allergy. Let me put these steroid drops. So I do have patients. In fact, today only, I have a child who's developed advanced glaucoma, 12-year-old, because of the steroid drops that they've been using for the past 8 years, twice a day. So unless you visit your doctor, and if the doctor has prescribed in a particular pattern, please follow it. And the redness in the eye need not always be an allergy. It's always your doctor to decide and not you. It cannot be the same reason every time. So, I mean, this message has to go.
See, Dr. Sneha, that is why in the foreign countries, over-the-counter drugs are not available. So this is the reason, because there is an abuse, there is an inertia and a lethargy to visit a doctor. I don't know whether it is because they have to pay the consulting fees or whether they don't have the time. But if they have the time to do other things in life, I think they should have the time to do this also. So this is absolute negligence by not visiting a doctor and just following whatever is written on the prescription paper. Second problem probably is the chemist who doesn't see the date on it and gives them the medications time and again. So, but then who is at a loss? It is you as the end user who is at a loss by not taking the advice. So I think there should be a lesson for everybody that they shouldn't do things like this. Visit a doctor. The doctor is sitting there to counsel you. Visit a doctor, do as he advises. And if you have a doubt, rather than not following the doctor, take a second opinion. There are many other doctors available. Even the slightest of doubt, take a second opinion, I feel.
Yeah, true, ma'am. So we've got another question by Purnima Shetty, is that do the eye exercises shown in YouTube help for healthy eyes? And are there any eye exercises for healthy eyes? So Dr. Prachi, would you like to say?
Yeah, so I think we answered this, we discussed this question earlier. So basically, I don't know which YouTube video you're talking about, because there are a lot of that way videos that keep moving about. But what can I say? The ones that are more famous or talked about is the palming exercises and moving the eyes in various directions. So as I said earlier, if that makes the person or the child or the adult feel better doing them, there is no harm in doing them. But it cannot say, it is not an option for healthy eyes, especially for screens, basically. Like if you do these exercises, then you're free enough to use the screen for 12-13 hours a day. It does not imply that. Also, no specific exercises are required for healthy eyes, basically. I mean, your regular healthy food, your regular hydration, all those things are good enough. Plus, I mean, if you're experiencing symptoms of headache or eye strain, then again, go and visit an eye doctor. If there are any other problems, muscle balance problems that we detect, then we can advise you exercises accordingly to treat those problems. But otherwise, just there are no routine regular exercises that you really need to do for for healthy eyes.
Yes. Shanbhag ma'am, would you like to add to anything for what Dr. Prachi has said?
No, I wouldn't. She has covered it almost well. And she has talked about this earlier on also. So probably the person who's asked the question has joined in later.
May have joined in later, yes. So we've got another question from from Nagnath Gaikwad. Mr. Nagnath is asking, do app drops have any side effects, which is our moxifloxacin eye drops? So Shanbhag
Mr.
ma'am.
Nagnath, I will answer this question. One, it's a drug. So any drug is not safe all the time. Second, medicine in optimal doses works like a medicine. Beyond that, it's a toxin. So does it have a side effect? Unless you're allergic to it, in the short period that you're using it, there won't be any side effects. But if you're going to continuously use it, it's like popping an antibiotic day in and day out into your mouth. What's going to happen to your gut flora? It's going to all get killed. Similarly, your eye flora is also going to get killed. So anything which is not required for a certain period of time or beyond it should not be used. Beyond it, it is going to work like a toxin.
Yes, Mr. Nagnath. So answering your question, minimal dose, yes, as prescribed by your doctor, not from the counter by yourself, and not to be used unless required. So coming to my next question would be that there are certain drops that are in the market now to get rid of eyeglasses. So is it true? And if so, for what? Dr. Prachi, please could you answer this?
So there are no
I think they are asking for myopin.
Yeah, exactly. So there are no eye drops to get a person rid of glasses. That's a myth. And there are no drops that can cure a refractive error. Yes, but we are practicing is the control of myopia. So the minus spherical power, which sometimes which begin in the age group of 4 to 5 years of age and generally tends to increase. Yes, we are using eye drops to control that minus power. So those are called as atropine drops for controlling myopia. So there are a lot of studies that are coming up for the use of these drops in various doses. From India, maybe for the last 5 to 6 years, we have been using this treatment for controlling myopia, and it helps. It is showing very good results. But yes, it's a long treatment wherein we need to use the drop for at least a couple of years and then see how the growth is progressing or is halted and accordingly taper and stop it. So there are drops for controlling the progression of spherical minus power, but there are no drops to cure refractive errors.
Yes. Dr. Shanbhag, would you please like to add anything?
I think there is an inertia in some of the parents when we advise them these drops because they feel that, what if the number still continues to increase? And I have had a few of these parents who drop out also because the number increases by 0.5 or 0.75. But what they don't understand is that it would have increased by -3, -4, and it has got restricted to -0.5 or -0.75. So when there is a documented study with a lot of case subjects, which is telling you that it definitely retards the progression, they should accept it and give it its time period and see what the results are in that particular child, unless there are side effects like allergies or something to that particular drug. So if it has been prescribed to your child, then your ophthalmologist knows what he's doing. Please follow his advice.
Yes, and Madam Nakul, what age would you prescribe these drops?
I have a study going on in my hospital where we start after the age of 4 until the age of 14. We give children up to the age of 14.
Yes.
And that is still like, they are supposed to get their retardation. The time duration is still the age of 14. So even if you start at the age of 4, you have to go to the age of 13 or 14. And you cannot stop before 2 years of age. But at the same time, there are other restrictions to the study where the child has to have outdoor activities which are compulsory.
Yes.
And then screen time is to be limited. A lot of things to it. So it's not just put the drops and do what you wish. There are certain other things also which need to be followed. But then I don't want to go into the details of the study over here. You should visit an ophthalmologist to get the details. And it's a long follow-up. It cannot be like, put the drops and continue for 2 years and visit your doctor after 2 years. It doesn't happen like that.
Okay. So we've got another question is that my child has back and forth movement of the eye, so which is involuntary, and is this normal? Dr. Prachi, would you please?
Yeah, so if I can understand correctly, whatever the question is put forth, this is nystagmus.
Yes.
These are the involuntary eye movements of the child. So to answer your question, is it normal or abnormal? I would need to know what is the age of the child. Sometimes nystagmus can be normal till 4 to 6 months of age, but any nystagmus persisting beyond that age is not normal. Okay, so that needs to be evaluated. And the evaluation would really depend by examining the child, depending on what is the type of nystagmus, and again a detailed evaluation to try and figure out the cause for nystagmus. And what I would like to add over here is nystagmus can be treated. We can make those patients better, but again the type of nystagmus would really dictate the modality of management for nystagmus.
Okay. Thank you, Dr. Prachi. So we've got another question from Priya saying that my daughter is 8.5-year-old. She has a +3 spherical and -1 cylindrical, vision being 615. Is it serious, and will the specs remain forever? So,
Difficult to answer.
Ma'am.
It's not serious, no? What is a +3 number? It's nothing. As long as the child can see, I think it's good enough. Now, the very fact that it is 6/15, that means it was higher than +3 before.
Yes.
And it has reduced to +3 by the time the child has reached 8 years of age. So the child has done pretty well wearing the glasses. She should continue wearing the glasses and she'll do well. There's nothing wrong with it.
Okay. And she has a continued question which says that her right eye vision is 615 with the +3 spherical and the -1 cylindrical, and left eye is 6/21. Is this serious?
Precisely. Left eye, what is the power in the left eye?
It's not mentioned it, madam.
So it depends. No? It's a half question, so there will be only a half answer to it.
Yes.
Visit an ophthalmologist, but at the moment, at 8.5 years of age, I don't think up till now, if she has been wearing glasses, that means she's visited an eye doctor. So they are under control, I presume.
Yes. So, Mrs. Priya, answering your question first, yes, we presume that you visited your doctor and that's what they've prescribed to you. Also, you need to do regular eye checkups for your child, maybe once every 6 months, and we need to keep a watch on the vision also.
And one more thing is, like, if the vision in that eye is less, then probably occlusion has been advised, which she has not mentioned.
Yeah, she's not mentioned anything.
Yeah, so also just keep the checkup going on. I mean, if it's been a long time, especially because of the lockdown, that you've not got the eyes check of your child, please go and check. There may be a change in the power also, which can also sometimes, cause an improvement in the vision. Sometimes if the glass power has changed.
So we have another question, So what are the causes of head tilt in children, which was not present in birth, but which was acquired later on?
Okay.
Dr. Prachi.
So what we need to understand is sometimes a misalignment in the eyes can actually cause a abnormal head posture or a head tilt. Okay. So the reason could be a squint. Okay. Number 2 reason could be nystagmus. So like a previous viewer had asked, sometimes there can be these involuntary continuous eye movements which happen to and fro. The eyes look very wobbly. So sometimes there could be a head tilt to overcome that problem and see better. And sometimes there could also be a glass power, an astigmatic power or a cylindrical power. So these are the 3 common causes, 3 common eye causes which can cause a head posture basically. So whenever a child has this abnormal head posture or head tilt, it is necessary that the child gets the eyes checked once by an ophthalmologist to rule out these 3 causes. If after a detailed thorough checkup, all these causes are ruled out, then it could be something related to the neck muscles or something like that, which then needs to be addressed by an orthopedic surgeon.
Dr. Shanbhag, would you like to add anything to this?
No, I fully agree with Prachi. She's covered most of it.
Yes. So coming to our next question is that we do see in clinic we have these newborn, 1-year-old, 2 year, 1 month old, 2 month old kids, and parents do complain that they have continuous watering in the eye. So, what could be the causes of it, and how can we go about with the treatment for it? Watering in eyes since birth, Dr. Shanbhag.
Commonest cause would be a congenital nasolacrimal duct obstruction. So if you teach them the correct way to massage, I think 90% of the times you can open the congenital nasolacrimal duct obstruction. And within a year, if it doesn't settle down, then there is something procedure called as mechanical probing, whereby you put in an instrument and open up the blocked duct. And it remains patent for the rest of your life, provided you continue with the massage even after that for a few months.
Yeah.
So this could be one of the cause. Second cause could be like, there could be a raised intraocular pressure wherein the child rubs his eyes and has watering. So there is a triad of, the ophthalmos, a large eye with watering, and the child is unable to tolerate light. That's called as blepharospasm. So that could be one of the other causes of watering. Third, it could be also because there is a refractive error, which is high ametropia.
Okay.
Sometimes there's infection in the eye, which can also give rise to watering. So unless you really have the case in front of you, you cannot decide what is the cause for it. There could be a battery of causes for it. And unless you see the child, you cannot pinpoint and, work in that direction. Because everything is a different entity altogether and the workup is going to be different.
Dr. Prachi, would you like to add something?
No, absolutely. Madam has covered it.
So, wait, just so, are there any specific food that would help get rid of my child's spectacle power? Is the question, Dr. Prachi?
Yeah. So let me clarify that there is no food stuff that is related to refractive errors of glasses. What we need to understand that we all know that vitamin A rich food is good for the eyes, which is very true. But what we need to understand, all these vitamin A rich foodstuffs is necessary for the proper functioning of the retina and proper health of the ocular surface, but it has nothing to do with the refractive error. So otherwise, foodstuffs which are good for the eyes would include carrots, green leafy vegetables, papaya, beet, tomatoes, pulses, and if you take non-veg, fish. So these are the foodstuffs that are rich in vitamin A and good for healthy eyes, but it has nothing to do with refractive errors.
Shanbhag ma'am, would you like to add anything?
No, I think what Prachi says is absolutely right.
Yes. So I think whatever is good for your body is good for your eyes.
Correct.
If we have to exactly sum it up, it would be that way. We've got another question where the parent is like, my child is 14 years old and at the age of 7, he had an injury with a tennis ball. And now I'm advised surgery for high eye pressures.
So what do they want to know? Whether to go in for the surgery or to take a second opinion?
This is it. This is the only question.
See, what happens is, if at all there is a trauma, then different layers of the eye could be affected. So in their case, probably the angle of the eye, which is responsible for the intraocular pressure monitoring, is damaged. So we call it as angle recession glaucoma. Now, it doesn't happen immediately. So if they have visited the doctor at that time because there's an injury and not visited the doctor for the forthcoming years, and suddenly now because there is redness, pain, watering, and pain in the eye, they have visited. So it is possible that the angle recession glaucoma has come to the forefront now, as a result of which there is raised intraocular pressure, for which now the only option would remain to be a surgery. But again, it has to be a case-to-case basis. Sitting here, we cannot judge what is happening in that eye. So this is just like, an outline of what I understand from the question and what I'm trying to advise. But if the doctor has advised, that doctor has seen the patient, so obviously it must be right.
Yes. Dr. Prachi, would you like to add anything?
No, absolutely agree.
Yes. So, something that I would like to say is with any form of injury to your child's eye, we do come across where they do have some blunt form of injury to the eye, and they immediately come for a checkup because there would be any swelling and all, which is right. But what our parents have to understand that you need to have follow-up checkups also, because at the time of injury, everything seems normal. But later on, weeks after the injury, you can have retinal breaks. There could be, some problem internally. The pressures may rise. So a follow-up for your child's eye is very important following any blunt injury. Even if at that time with the blunt injury he didn't have any symptoms, so you'll have not got up. But later on, at least please do follow up, because these secondary issues that we see in a child's eye are
Especially, I would like to interrupt here, Sneha.
Yeah.
Especially cricket ball injuries. The eye is swollen, so they'll come to you. You will give them some anti-inflammatories and drops. And the minute the swelling is gone, they won't come back for a retinal checkup. 5 years down the line, they will come back with a retinal detachment and they'll say, "But we came to you 5 years back. You did not tell us that this is required."
Okay.
You have written it in the follow-up that you need to come back for a retina follow-up, but it's not done. And then they end up with a major disaster. So please, please, please follow up with your doctor and follow the advice.
Yeah, so somewhere I think parents has to, like, everybody have to understand it. You don't have a problem doesn't mean you won't have a problem in the future. So it's not, symptoms are not always required, because by the time maybe you come to us, it may be a little bit late. So we've got another question from Meena, which says that, "Ma'am, would you please explain the technique of massage in nasolacrimal duct blockage?"
There must be a YouTube video. Why don't you try that? Because from here it is very difficult. I can show it to you on my eye. See, this is probably your lacrimal apparatus. You just place a finger on the nasal aspect of your eye. Press it over there. Once you have pressed, there is a pressure which is generated below it. Now the duct is below it. Then you just follow the curve of the eye. Only so much. Press here, generate the pressure and follow so that the pressure is taken forwards. This pressure which you have created by pressing on the nasal part of your eye is now going to open the duct. So if you do that almost 10 times every time for at least 3 to 4 times a day. So you have to do probably 30 to 40 times. Now the child's skin is very delicate. So a mother's hand is probably the best hand to do it, and very heavy. So it works. I have had one in my own family which has got cured because of a massage.
Yes.
And it's very easy. And the second thing why we advocate that you do it very sincerely is that the next option is a surgical procedure under general anesthesia, which could not be a very good option when you could have just managed with a massage. So please do it sincerely if you can do it, and ask your doctor. They will teach you how to do it. Everybody knows it. We are taught in our training how to do it. So it's not a very difficult thing. Whoever has seen your child, please go and ask the doctor. They will guide you how to do it.
Yes, I mean, Dr. Shanbhag has already shown you, Mrs. Meena, about how to do a massage. But if you're not going to count the number of times you're doing, just look at the clock. 2 minutes, 4 times a day, at least, is the minimum that you must be doing, and follow up with your pediatric ophthalmologist. So just let's take a few more questions. So I think we're done with most of the questions out here in our chat box also. So Mr. Ravi, are you there? Hello. Any more tips, Dr. Prachi, or any more suggestions you would like to give to our parents who are watching us today, and the take-home message for all our parents and kids?
I would just try to suggest some take-home messages from our chat show today. So number one, about the screen, as we said, frequent breaks are extremely important. Make sure that your child takes a break of at least 15 to 20 minutes after every 30 minutes of screen time. Bigger the screen, the better it is. Adjust the illumination of the screen well to suit the child's needs. Blue blocker glasses is not the answer to protecting your child's eyes from the screen. Squint, minor, major, whatever it is, any squint, if it is noticed, it is mandatory to visit a pediatric ophthalmologist once. Refractive errors can be checked in a child from the youngest of ages. We recommend a routine checkup at 1, 3, and 5 years of age in absolutely normal children. Maybe earlier if there is a family history of eye problems. And I think anything to add on to Nita, madam?
Yeah, I think if they have followed us, there is no need to give them a take-home message. Everything was a take-home message.
Yeah.
You were very good, Prachi, in answering everything. God bless you.
Yes, so I think that sums up the session for today. Thank you, Nita ma'am, for your time, and thank you, Dr. Prachi, for
Thank you, Dr. Sneha.
wonderful session. And I hope parents get our message. Nothing is minor, nothing is major.
They can still,
Yeah. Sorry, madam.
I would suggest that if they still have some questions, they can put it on the chat box, and then you can, along with their emails, if they put, they can be answered at a later date.
Yes.
Sometimes they may not remember what needs to be done. But again, a one-to-one counseling is far more better than any of these. We are just trying to make you aware and guide you. This is not a substitute to a consultation. So please do it from your nearest doctor, person whom you are happy with, have been visiting them for years together. And if you want a specialized opinion, then yes, a pediatric ophthalmologist who is close by. And I think that should do the trick, and your child should be safe. In this COVID times, I wish all of you all stay safe, stay alert. There is a lot of talk about a second wave. Remember, the vaccine is far away, but your mask is your vaccine. Kindly use it judiciously. Make sure that you don't touch the front of your mask. Make sure that whenever you are in front of somebody, don't remove your mask to talk or to eat, because that is where the virus is going to come from. I think this message is very, very important in this pandemic. That is why I'm giving it, despite it not doing anything with pediatric ophthalmology. Stay safe, and wish all of you a healthy life in the years to come.
Thank you, ma'am.
Thank you.
Thank you, and thank you, parents. Any questions, you all can please email us. And thank you for this session. Thank you.
Thank you, everybody.